All right. Hi, everyone. Welcome to our Wednesday webinar. Let me make sure I have everybody in now. A few more of you are joining. Thanks for joining us. Happy Wednesday. We're almost through the week. And for those of you that are counting your days, it's Wednesday. I know, what is this, week 9 that we're on this? So it seems like it's lasting forever, but I'm glad to be back with you guys on Wednesday. Some quick announcements from the Community Foundation before we jump into our topic today. Our needs request form for you to submit any of your needs that you have is still available. So you can find that on our website or on our Facebook page. We will be sending out our 3rd assessment hopefully next week. So please be on the lookout for that assessment. These assessments have been extremely helpful in helping the Community Foundation share this information with funders, share it with even groups around the state about what our nonprofits are going through and how things are shifting. So we'll be sending that 3rd one out next week. So be on the lookout for that. And then, of course, you can always visit our Facebook page. You can visit our COVID response page on our website, cfncf.org, to stay up to date. So we've been hearing from all of you about different topics, and this is definitely a unique topic that we've gotten today. But as people are starting to reopen, as many of the nonprofits are starting to accept people, clients back in, starting to have your staff come back in, or even starting to prepare for what that might look like, we wanted to bring some experts in to talk about what that could look like for you and your team. So we have 3 speakers today. First, I'm going to introduce Cindy Prins. Cindy is Associate Professor of Epidemiology at UF. And after Cindy's presentation, we're going to move to John DeCarmine, Executive Director of GRACE, and he's going to explain sort of a real-life example of what's going on. So we'll take Cindy's advice and then turn it really into what does it look like for someone local here in our community. And then we're going to end with Laura with Meridian, Director of Prevention, who's going to be helping us talk about mental health, our employees' mental health as we move forward. So we're going to start with Cindy. So Cindy, I think I'm going to unmute you. Let me know let me find you. Hold on. All right, Cindy, are you with us?
I think I am.
Perfect. Welcome.
Thank you, Leslie. I appreciate it. Thanks, everyone. I'm really looking forward to kind of interacting with you. I'm also really looking forward to hearing more about what John's been doing, because he's really had to put a lot of stuff in practice, I think, to keep folks safe right now. I put together just a couple of slides to start a conversation. So we'll go ahead and share that screen, but I don't intend for this to be a one-way conversation. So I'm definitely interested in hearing your thoughts and questions. So let me go ahead and get that started up.
And Cindy, while you're doing that, everyone, if you would have any questions, please type them in the chat bubble. If your question is too long to put in the chat bubble, just send a message to me in the chat bubble that says, unmute me, and I can unmute you to ask your questions.
And if you can help me out, Leslie, which version? Are you seeing just the PowerPoint version, the actual slideshow? Because I've got 2 screens here.
Yes, it's just white. Yes, I can see. It looks like I'm seeing the presentation side of it.
That's what I was wondering. Okay.
There we go.
All right, great. Thank you. Okay, so as Leslie mentioned, I'm Cindy Prins. I'm at the University of Florida, and by background, I actually started out as a virologist and then went into epidemiology, and I'm certified in infection control. So I think of this from a few different points of view. I'll do my best to answer questions for you as we go along. I wanted to get on the same page about COVID-19. I know everyone knows a lot about this already. Everyone's kind of had to have a crash course in virology, but it is caused by a virus called the SARS-CoV-2 virus, primarily transmitted through aerosol droplets and then contact with contaminated surface. So when we say aerosol droplets, we're talking about when you cough and you sneeze, and these heavier particles, moist particles, come out of your mouth and nose, and they contain virus within them, and they typically fall within about 6 feet of the person who's coughing, sneezing, singing, laughing. All of those situations can create those aerosol droplets. We have looked at respiratory transmission. It's still not quite clear whether respiratory transmission, which means breathing it out or it kind of coming out with air while you're talking, is a major factor. We know there have been some situations where a choir group got ill because the effort of singing was expelling the virus. So we're still learning a little bit about that. Contact with contaminated surfaces, the issue there is that when you touch a surface that's been contaminated with COVID, and then you wind up touching your eyes, your nose, or your mouth, you can self-inoculate. You can bring that virus to the cells where it can get within your system and start replicating. We also know there's asymptomatic and pre-symptomatic transmission. There's a lot of different versions of how many people are asymptomatically infected. I've seen anywhere from 25 to 50% of cases are actually asymptomatic. And again, we're still figuring it out, but that can be actually a decent number of people. Pre-symptomatic transmission means that within the few days before you actually start developing symptoms, you can spread the virus around. And we typically look at 2 days before development of symptoms for people to be able to transmit. And so as you're kind of coming back to your workplace, you want to think a little bit about symptoms and about your own wellness and the wellness of the people around you. This is from the Journal of the American Medical Association. It shows the prevalence of some of the symptoms. And I wanted to highlight this because we think of fever, which is sort of toward the middle of the slide. We think of that as being a major symptom, but in this study of 200 patients, only about 55% had developed fever. Dry cough, about 60%. And then you can see you've got a variety of other symptoms that people can develop, including we have here at least a large report of that smell and taste disturbance, which we've been hearing about as an early sign of COVID-19. So we've been relying on fever as a marker for having COVID-19. And as you come back to work, it probably does still make sense to do temperature checks and to make sure that people don't have a fever. But keep in mind that that needs to be regarded in the larger context of all of these possible symptoms that someone can have. And, my thought is always, do you feel healthy? Do you feel well? And if you don't, then you probably need to stay home and make sure that you're not actually ill. And then, so considerations for a safe return to work. So primarily, as we said, are you symptom-free? If not, then stay home. And then think about the layout of your own workspace and the people who work with you. So can you maintain social distancing? And if you can't, are you going to be able to move people around to put some spacing between them? Obviously, it would be ideal if everyone has their own office space. That's not going to be possible everywhere. And I know a lot of office spaces are these beautiful open collaborative spaces that we've moved to over the past few years that are just great for maintaining social distancing. So, you really want to make sure you can put some distance between people, at least 6 feet, but keep in mind that you need a perimeter of 6 feet. Can people wear a mask at work? It's not comfortable, but if you're in a situation where you are going to be with a group of people throughout a day and you can't actively be in your own office, please consider wearing your mask at work. Reduce access to areas where people gather. So think about things like the kitchen and other common areas. And are you going to be able to either prevent people from accessing those common areas, or at least make sure that you don't have 4 or 5 people in a kitchen area at a time. Staggering break times can be one way of dealing with that. So just making sure that you don't have everyone running for one area at lunchtime. And then limiting restroom capacity. So think about the size of your restroom, what the normal capacity of that is, and think about maybe limiting that by about half by asking people to wait outside if they know there are others inside. Enhanced cleaning and disinfection, you want to think about that in the workplace to protect yourself. So you identify your high touch surfaces for yourself, and that means going around and thinking about what are the things that people most frequently touch in the building. So it's not necessarily within your own workspace that only you access, but it's more about the things that everyone's touching, like elevator buttons and doorknobs, handrails. If you do have a kitchen, you have to think about the faucet and the refrigerator and the microwave. And you can kind of observe people as you're going back to work and see what those surfaces are and start to make a list of them for yourself. To clean, you want to use an FDA-approved disinfectant, and you can search for this online. If you put an FDA-approved disinfectant COVID, pardon me, and then you'll get a list of those products. There are a lot of different products you can use. And you want to clean those surfaces at minimum once a day. And keeping in mind that things like doorknobs, you may actually want to do a little bit more frequently than that. When you're using a disinfectant, actually, let me back up a little bit and say there is a difference between cleaning and disinfection. So cleaning is when you're using soap or some sort of detergent to actually remove dirt from a surface. You would think about that with our hands, but you can also use soap and water on a countertop. When we say disinfection, we're actually talking about removing, killing, and activating microbes from that surface. And so disinfectants are regulated by the FDA because they're tested for whether or not they're going to be able to do that. So you want to be aware of the contact time you use. What we tend to do with disinfectants is we don't use enough, so we're not wetting the surface the way we're supposed to. And then the disinfectant will tell you how long it should be in contact with the surface. So it might be, 10 minutes or so that it takes for that disinfectant to actually work properly. Sorry. And then you want to think about enhanced hand hygiene as well in that atmosphere. So when you wash your hands with soap and water, the friction of rubbing your hands together and then the use of the water to rinse off your hands actually kind of dislodges and rinses away those viral particles. Alcohol gel will work against COVID-19. It inactivates the virus, but remember again, you want a contact time. So you want to put enough alcohol gel on your hands to cover the front of your hands and the back of the hands, to get a little bit under the nails if you can. And then you just want to keep rubbing that around until it dries on its own. You don't want to wipe it off or wash it off. As far as how long does COVID-19 last, so persistence on surfaces, this is from the New England Journal of Medicine, and a group studied how long they could isolate active virus from different surfaces after they had applied a controlled amount. So for plastic, they were able to still isolate active virus for 72 hours after they had applied it. Now keep in mind, it decreases over that period of time, but it was still detectable. The same for stainless steel. Cardboard was at 8 hours, and then copper, which we know has some antimicrobial properties, was at 4 hours. And if you think about your workplace, you're probably thinking, boy, we mainly have plastic and stainless steel. I think that's what a lot of people are dealing with. So keep in mind that 72-hour persistence on those surfaces and wanting to keep those clean. And then finally, gloves. I see a lot of people wearing gloves around town. I'm sure you're seeing that as well. And I generally feel like gloves aren't needed. I know some folks wear them because they feel like if they have them on, they're less likely to self-inoculate, to touch their face while they're out and about. For me, I feel like gloves actually kind of encourage transmission because you're not being careful of what you're touching. You're forgetting to do hand hygiene. So, if people are insistent on wearing gloves, I think just keep in mind that you do want to remove those and do hand hygiene and keep up with that. But I think the only time I recommend using them really is when you're using some of these disinfectant products, because they actually can be caustic to your skin. So that is what I had put together, but I am happy at this point to answer any questions that you might have. I see we've got one. Couple. And from David, how do you suggest we balance the very real need to get 30 million Americans back to work with the very real fear that people have of this virus? Seems many of the predictions have been incorrect, expected with the unknown, I assume. So yeah, thank you for that question. I think there's a mix of opinions on whether the predictions were wrong. I think a lot of it, the reason we didn't have the number of cases that we were expecting was because we actually were very good at doing social distancing. But models aren't always 100% either. But then, yeah, how do you get everyone back to work? And I think we have to maintain the principles that we've been living under and bring them into the workplace, right? And so the idea is you can't go back to work and be normal. You have to go back to work, unfortunately, within this COVID mindset of staying away from other people, of being in the work atmosphere, but trying to apply that infection control the best that you can. That's going to be different levels for different people. But we've seen places make it work. I mean, we've seen places like supermarkets and restaurants doing takeout who've put good safety measures in place. So it's doable. It's just, it's not going to be the same as it was before, and it may be a while before it is.
So Cindy, some questions are coming directly to me. So it's okay if I read them to you?
Please, yeah.
We have one that says, we hear of many different resources. What are the best places we can go for the best resources for up-to-date information about or what we should share with our employees?
Yeah, so there are a ton of different resources. And right now, I know that there's been some question of the CDC and how they're going to be releasing their plan for businesses to get back together. So definitely looking to see that at some point. The Florida Department of Health has good resources as well for that. I've been, as far as, looking at levels of cases and things and thinking about that, Johns Hopkins is a really good resource. And then even Alachua County, though, has their own resources for helping people out. And if you're having a specific question or you need a specific resource and you can't find it, please feel free to reach out to me. I'm happy to provide my email address.
Thank you. A few more questions. Yeah. One is, this is an interesting question. I'm trying to figure out how to word it. It's kind of long, but they're asking, when do we know the appropriate time to go back to work? I mean, should we be following the state's phase-in program? What makes the most sense for us?
Yeah, I'm appreciating that there's a phase-in program. So the concern, right, is that we all go back to work. We all think we're back to normal. And then the next thing you know, because we still have COVID-19 circulating in our communities in Florida, we wind up with more cases, and we wind up in the situation where we have what we're worrying about as the second wave of COVID-19. So, for me, I'm really hoping that these phases are going to be longer phases. I've been hearing something like 2 weeks. If you think about the way we identify and track cases, how long it can take to get tested and get the testing back, I think we probably need more realistically like 3 or 4 weeks per phase in order to really see, is what we're doing now increasing the number of cases? We've just opened barbershops and hair salons. How is that going to affect our level of cases? We're allowing for 25% capacity in restaurants. What's that going to do? So for me, I think the phases are good as baby steps, but we need to keep that monitoring going of each phase. And so I encourage everyone for yourselves to keep an eye on that. Again, the Florida Department of Health does case counts. They have that on their website. When you look at those, keep in mind that there is a lag. And so I usually look back about 5 days or so for cases. The lag is even longer for deaths to be recorded. So, if you see a downward trend in the past couple of days, don't assume that that's a true trend.
So it looks like we have 2 more questions. I'm trying to get through these 2, but we can keep, of course, we can always keep the questions going and come back if we have time at the end. But one question, should we be taking temperatures? Does that make a difference to take temperatures of employees and or clients?
I think a lot of people are doing that, and I don't think it's a bad idea. Anytime someone's running a higher than average temperature, it's going to be a marker of some infectious disease process, most likely. So even if you're not preventing COVID, you could be preventing something else. There's some privacy issues there, so it's got to be worked out within the workplace setting, whether or not people are willing to do that. Again, keeping in mind that you're only going to maybe catch about half of symptomatic cases because not everyone is going to develop a fever. And the set fever for COVID-19, they look at it being above 100.4. We all have different body temperatures. We have different ranges. I encourage people to self-monitor. You tend to know what your own range is. So, if you normally run in a 97.6 and you're up to a 99.5 and you haven't been doing anything to exert yourself, well, that may be a fever for you. So keep that in mind.
And last question for now is someone's asking, what should be your routine upon returning home? Should you be washing your clothes immediately? What should you be doing after you've been out and about?
Yeah, great question. So my routine is, the first thing I do is I go in and I clean my hands. Actually, when I get into my car, I make sure that I clean my hands. But once I get into the house, I do like to clean my hands. I like to go get changed. I put those clothes in the hamper. I don't necessarily throw everything in the washer right away, but I don't rewear them. I tend to keep sort of my outside separate from my inside. And then the other thing I try to do is just remember to go around my house and clean my own high touch surfaces so that, when I've come home, every once in a while, clean your steering wheel, clean your cell phone. You can use an alcohol wipe for that pretty safely if you're not wetting it down completely. Clean your taps and your own doorknobs so that you're not bringing that virus in with you.
Thank you, Cindy. And we'll have you here to ask more questions at the end if we have some extra time and to ask more questions. But I wanted to move into John's presentation. So I'm going to unmute John. And John's going to talk about, what does it look like when you actually implement some of these practices and what Grace has been doing, because they have remained open and remained serving clients. So John, can you hear us?
I sure can.
Awesome. We can hear you. Go ahead.
All right. Well, thanks so much for having me here. And thanks, Cindy. That was really great information. We've been monitoring every bit of information we can to the point where, I'm going to talk a little bit about staff wellness and mental health. I would say that the amount of time we have spent monitoring news about this has been the single biggest factor in not having great staff wellness and mental health sometimes, because it's really hard not to try to stay up. And a lot of what we've found is that the best information we have available can only be implemented imperfectly. And I think that example of taking temperature at our front gate has been one of those. We know that there's a study that just came out from the Boston Healthcare for the Homeless Council that found 100% of the people who tested positive in a shelter there were asymptomatic. And we also know that we have a mission to end homelessness. We have a mission to be available and provide these resources for people who literally have no place else to go, who literally cannot be safer at home because they don't have a home. And for us, this has been largely about trying to balance how do we protect and preserve the health of our staff and our existing residents with the health and the well-being of people who may not be able to access our campus right now. So I'll kind of run you through a little bit about what we've done to keep safe. If you're not familiar with Grace, our campus is kind of unique. It's a 25-acre one-stop assistance center. We operate a 114-bed low-barrier emergency shelter, which means it's in our DNA to try to provide our services to anyone and everyone in any circumstances. So this has been a little bit of a shift, but we figured out really, in fact, how to double down on our mission. And that's been one of the big things that we've communicated with our team, is that the work that you do now is more important than it's ever been. And it was really, really important to begin with. So for us, what that's looked like, we suspended all of our volunteer programs and our meal groups back in March. We're in the middle of doing all these different things that we all thought were going to be for 2 weeks, and we're coming up on 2 months right now. We've had no new shelter entry since March 20th, and we had been working to try to get as many people out of the shelter as possible and into apartments. We've moved coming up on 50 people into housing since we closed down the campus to visitors, because we have vulnerable people sleeping in a room with 100 other people, and there is no congregate setting that is safe. And in fact, what most of the research we've found is showing is that COVID tends to hit the homeless population later, because generally the homeless folks are not the ones on cruise ships or traveling through airports. However, once it hits hard. In San Francisco, there's a shelter that had its first reported case in the city on 1 week, and then 7 days later, they had 70 cases. We've seen similar things where it went from the first case among homeless people in New York City to 371 just a couple of weeks later. So the issue for us has been, remembering that we may still be closer to the beginning of this than we are the end. And that fatigue, the reality of that, has been part of what we try to communicate with our team every day. The general list of what we've done, we of course have made sure that not only our team, but our guests all have access to whatever personal protective equipment they need, whether that's masks. We've had some great volunteer groups who have been involved in bringing us masks. United Way has been great about lining up supplies for us. We've switched all of our meals to to-go meals. We've been in voluntary quarantine, which is not a lockdown, but a simple encouragement of unless it's absolutely necessary, please don't leave the campus. We'll continue to provide food. We'll continue to provide anything else that you need here. We have actually planned out, but have not yet implemented a managed alcohol program. So on the knowledge that if we do go into a lockdown and we are telling people they can't leave the campus, what are the major reasons that would make them leave the campus? And for the reality of it is same as most of us. The answer is, well, I'd really like to get out of here because I'm stuck here. I need to go get booze, or I need to go get cigarettes. So we actually have sort of spec'd out a plan for what it would look like to provide alcohol and tobacco to people in the interest of public health, knowing that that might keep them from leaving the campus. We have not had to implement that yet, but we are prepared to do so. We hired a lot of people from bars and restaurants. We've also been really fortunate in that the bars and restaurants around this town have been wonderful supporters of the work that we've done. So as they started shutting down, one of the first things that we did was reached out to them and said, hey, we understand you have people who need hours, who need work. If any of you have done restaurant work in the past, you know that it's at least half just walking around in circles and disinfecting things and wiping things down. That's what we're paying people to do here. So we have a team of people from other community partners who just have a cleaning checklist, and they're wiping every high contact surface, 10 times a day. And that runs from about 9 a.m. to 7 p.m. every day. We are trying to stay at 70% shelter capacity. For us, that's kind of a big deal, because when with some of our programs, we get a per diem rate for the number of people who are in those beds. And so we've had to really brush up against, this is the safe thing to do, but that safe thing is costing us $15,000 a month that we don't really have in reserves. Likewise, cutting out volunteers and meal groups, that was about $50,000 a month in support for our programs that we are actively not benefiting from right now. And then the biggest thing for us with safety has been working with the UF Emergent Pathogens Institute to get testing out here. We've had it out for about 7 or 8 weeks now. So we have tested about 250 people. Our staff are tested every 2 weeks. Anybody who wants to be tested can be tested. It is not the most comfortable thing. It's not the most uncomfortable thing, but we've tried to encourage as many people as we can to get tested, to do to keep the campus as safe as possible, with, of course, some contingency plans for what would happen if somebody came back as a positive. But so far, 100% of those tests have been negative. I think the thing, and before I move on to staff wellness and what we've done with that, I want to give JT, who I saw on this call, a shout out for doing an amazing job making sure that our donors and our volunteers still feel connected to our mission through all of this. So in some cases, he was finding folks who would put picnic tables outside so we could still have people sitting down to eat in a socially distant way. He's launched a fundraising campaign that ties into the idea that we are getting people out of our shelter right now, and that donations that are coming in today are being put into use tomorrow to make sure that we're keeping that shelter capacity as low as possible. To go into some of the staff wellness stuff, I think a lot of this is as much a part of what our culture was before the pandemic as it is now, but we've really emphasized making sure we're all taking care of each other. And I come from a background of having spent a lot of time at nonprofits that often treated their employees like garbage because we thought that our jobs mattered and we were therefore willing to take it. And one of the things that Grace, I think, does really well is we refuse to do that. We are absolutely committed to the health and the well-being of the people who work for us. And what that looks like now is talking to people, listening to people, finding out what they need, and then making it happen. So for that means, of course, the bare minimum, making sure people have personal protective equipment, making sure that if somebody does not feel safe coming into work. We've got folks who are over 65. We have folks with underlying health conditions. We're paying them to stay home. Some of them are working from home. Some of them are not. But I don't see it. They would have been here if they could. And therefore, I don't see this as their responsibility or their financial burden. This is something that we carry for them. And we'll work out when we can how to get them back. We have suspended our PTO cap because, like many of your organizations, we have a use it or lose it kind of thing, where for some people, after you've hit 80 hours, you stop accruing PTO. For others, after you hit 160, you stop accruing. Well, there's not a lot of places to go right now. And in fact, staying home with your family who's in quarantine is sometimes more stressful than going to work, no matter how stressful your job might be. So we're not putting any kind of requirements on people using PTO. If you need a mental health day, that doesn't come out of your PTO. This is kind of a big deal. There's a global pandemic. It's totally normal to need mental health days, and we're not going to penalize one of your employment perks by you having the strength to come up and say, you know what, I'm really not doing well right now. We'll send people home. We have our leadership team and our management team taking rotating days off. Again, that don't count against their PTO. It's about making sure that when they do show up to work, they're ready to work. And if they can't do that, then they get what they need to be able to do that. We've spent a lot of time celebrating successes, making sure that everybody knows that we are moving people into housing actively, that we are working harder than ever to, getting somebody to sign a lease when they can't get to the DMV to get an ID to sign that lease requires a lot of really creative workarounds. And so we've been trying to celebrate what we have figured out, what we're able to do. We brought in weekly lunches for everybody. Again, going back to those same restaurant partners who've supported us in so many different ways. And finally, we have been really just trying to encourage people to remember, I think one of the hardest things that I've realized and that others have discussed with me is that in this work and in the nonprofit world in general, you generally feel like everything is happening all at once or nothing is happening at all. And helping people understand that it's okay to feel like you're having the most amazing productive day. And then it's also okay to feel like you're not getting much done today. And that's not a threat to your job. That's not a threat to our mission. That's about you setting your own boundaries and kind of figuring out where to draw those lines so that when you do show up, you can be the best you can be for the folks who are here. I'll leave it at that and be happy to answer any questions. We've got some ideas on what it's going to look like for us to slowly but surely reopen, but we are kind of following, well, I don't have a lot of faith in some of the guidance I've seen on how and when to move forward. I'm naturally skeptical of much of that, and I'm not willing to put the lives of the people in our program on the line. So we are keeping an eye on nursing homes, particularly and half the people we serve are 50 and above. Nobody was healthy or well to begin with. So that idea of screening people and being like, hey, do you feel sick? The answer was yes before there was a virus. And the answer is probably still yes. And I don't know that that can be used to preclude people from being able to come back onto the campus. So if anybody has questions about that, I would love to answer them or answer offline or whatever's best. And again, thanks for having me today.
Thanks, John. We've actually got quite a number of questions, so I'm going to try to go through them. One just came in that says, do you require your staff and residents to get COVID testing, or is it voluntary?
So it is voluntary, and it has to be voluntary because Abigail, our amazing community engagement manager, got us linked up with UF's Emerging Pathogens Institute. So it is actually a UF research program through the Institutional Review Board, which explicitly says there can be no consequence for not participating in this research. Therefore, I would see a pretty big consequence as, hey, we're going to deprive you of the things that you need to be safe if you don't do this. So it has been voluntary. There's a lot of kind of the social norms around social distancing our staff has been modeling to the best extent possible. And that has helped a little bit, but we are not able to require that somebody gets a test right now.
Now, there's been quite a number of questions, and so I'm going to try to sum them into one question about your fundraising. And I think that one of the questions was really interesting. It was asking about the extra expenses that you didn't already have budgeted, the extra cleaning, the employees for cleaning. How are you able to fundraise for that and readjust your budget to fit those needs? I think that's the best of summing up those questions.
Yeah, well, I mean, first of all, nobody wants to donate to you to buy cleaning supplies. So, but if you can take the money you would have spent on cleaning supplies, move that towards getting people into housing, you can start to, work your budget around. We did apply for and received an SBA payroll protection program loan. I think we got in about 17 seconds before it ran out of money the first time. So what we've done with that is we've set up our own QuickBooks job that treats that as a funding source. All COVID-related expenses that are eligible are being booked to that for the next 8 weeks. And by being ready to do that, that has opened up some additional funding. We checked with our funders and said, look, we have this opportunity to move 8 weeks of payroll and some utility costs over to the SBA loan. Since we're doing that, can we use your money that we normally would have been paying those salaries with, and instead hire folks to clean and disinfect the campus, to move people in, to pay first, last, and security and all of that. So it was about the willingness of our leadership team and our board to support us moving quickly when there weren't in the absence of the clear answers that we needed. We had the trust to move forward so that we could do what needed to be done and continue to provide for the people here.
That's great. That's a great segue into the next question. It's about what's been your board's involvement, and how have they helped guide you in these decision-making processes?
So our board is generally really awesome. Getting into the moments where we are regularly communicating via Zoom. We're going to have our first Zoom board meeting tomorrow. We have been able to really lean on them for lots of support. They put up a great matching fund for the fundraising campaign. To be honest, I feel like I have sort of failed as an executive director by not knowing how to bring my board in more. But, again, our whole thing with our campus being closed is not about protecting the general public from homeless people. It's the exact opposite. Like, I love my board, but they're much more likely to have been on a cruise ship than the people that we serve. So therefore, we don't want them to be on campus, and we continue to work to try to find ways to get them involved. Our board is generally great at being available for crisis guidance, for leadership, for whatever it is that we need. And we have a good working relationship where there's an understanding that we are the ones who are here to do the work, and they're here to support it and to do, help with policies and help with all of that. So I think the roles that we had established, which were based around the work happens here, their guidance and the support has been able to continue through all of this.
That's great. I think some other questions I'll probably send to you. They're much more specific, so we'll send them to you. Maybe I'll let you reach out to people individually, if that's okay.
I'd be happy to, sure.
Perfect. Well, I think John's going to stay on the call too, so we can ask some questions at the end, but appreciate you sharing what you're doing and kind of turning in best practices into what it looks like in the real world. So thank you so much for that, John. I want to move on now to Laura. We have Laura Holly here with Director of Prevention with Meridian to really talk a little bit about what John talked about, but talk about mental health and what we're looking for ourselves and with our staff. So I think I unmuted you. Are you unmuted?
You did. I'm here. Awesome. Thank you. Thanks for having me. John, you guys are doing some great stuff with your staff with wellness. You're absolutely nailing that. It's all about communication. So I'm going to expand on some of the concepts you introduced already, but there's a couple of things as leaders and as we look at bringing our people back, right, that we really need to keep in mind. And one of them was touched on, Cindy touched on this, John touched on this, Leslie, you touched on this, and even some of the comments and questions, right? So there's fear. There's a lot of fear. There's a lot of conflicting opinions. There's a lot of, this is what's being put out, but I don't know if I trust it. This is what's being speculated, right? So there's all of that. One look at your personal Facebook page can tell you how everybody feels about everything, right? And if you happen to have a lot of like-minded people on your page, hop on over to like Gainesville Word of Mouth. You'll see what I'm talking about, right? So there's a lot being discussed, and not all of it is fact-based. And not all of it is easy to hear or understand, but we serve people, right? And we serve our staff, and we also serve the people that we serve. So we have all of these different people. One of the things that I need you to remember, really, if you want to achieve wellness, is that we are in a crisis. And I say you are in a crisis. Your people are in a crisis, right? Just because you're the leader doesn't make you immune to the trauma that we are all experiencing. So we've heard the phrase, we're all in the same boat, right? I don't like that phrase. We're in the same sea, but my boat is different than your boat, right? Your boat looks different than mine. And that's part of what we have to remember as we are bringing our people back to work, right? So you need to take a look at this as a process and not as a singular event. And we've covered that already. We're seeing that in the phasing and all of that. So as people are coming back, you know, you have a situation like John was describing where some people can't come back, right? So they're working from home and that's being accommodated, and that's awesome. Well, what about the person that's sitting in the office that becomes resentful of that, right? What about the people that say, well, I'm able to come back to work based on these requirements, but I'm not willing because of my own fear or my own anxieties, or the what my boat looks like, right, is different than what this person's boat look like, and that what that person's boat looks like. So that's something that we really have to be aware of. The only way to combat that is clear expectations. I do want to share something that from an employee standpoint that Meridian did for all of us that I think was a really good model. So in the very beginning, for weeks now, every week in our management meeting, assumptions are being shared, right? And so these are the assumptions off of which our organization is making decisions. So when we say you all have to wear masks, it's based off of an assumption that's on that list, right? So if you have an issue with the assumption, you can verbalize that, you can talk about that, there's an avenue to express your feelings, but at least it doesn't leave people feeling like, why are they doing that? Is that just because of this, or is it just because of that? Why did they ask us to do this? Why can't we work from home? Why can this person? If you kind of put out that list of here's what we're working off of. And one of the best examples was very early on, you know, I work in prevention. I'm the director of prevention, and so we do most of our programming in the schools. So they started to reallocate my staff, and I panicked, right? Like, what are you doing? Why are you taking my people, right? But the assumption they were basing it off of was that schools were not going to reopen long before the announcement was made. And if that assumption changed, then the actions and behavior would change. That's the level of communication that I think we really need to address people that are afraid and that are in crisis, right? They need to know not only what the policies are, what the new normal looks like, but they really need to know the why. And they need to know why it's being done and how it impacts them. John said something very important when he talked about being mission focused, right? So that's a big part of this, right? If people believe in what they're doing, they're going to be more open to returning. It's not just going to be that wall. So, so being mission focused is incredibly important. Remembering that it's a process, not a singular event. I cannot stress communication enough. And remember how you would interact with somebody who is in crisis if it was anything else, right? So in crisis, we need clear instructions. We need them to be simple and we need them to be brief. So when we're sending out emails, it should be bullet points, things like that. When we're talking to somebody, make sure the expectations are very clear. Make sure to answer all of the questions and set aside time. Your leadership is going to take more time now than it did, right? So we can expect that. People are going to have different needs. They're going to have different fears. They're going to have fears and concerns you haven't even thought of yet, right? So, so that, and you have to be prepared to hear those things in each other. And of course, there's a challenge between communication and confidentiality. They're going to want to know how many people are out, what that looks like. Has anybody tested positive? And as long as you are walking through that with trauma informed, that's what it is. You have to treat the staff and the team from a trauma informed approach, because we are all going through a crisis, right? Along those lines, the other point that I really want to make sure I mention today is to take care of yourself. Lots of times leaders feel like, you know, I got this, right? And you might be more naturally resilient. You might have more tools in your toolbox, and that's okay. But it does not mean that you are not experiencing the same trauma and crisis as everybody else. It's like when you're on an airplane and the oxygen falls down, you want to help everybody around you, but you got to put it on your own face first. You need to put this on your own face first. And you need to make sure, if you're telling people to take mental health days, that you're doing the same, right? And you need to make sure that you're, you know, if you're saying wear masks, you're wearing a mask, you know, things like that. So we want to make sure that we are not losing sight of the fact that we're sharing in this crisis and in this trauma. And communication, you cannot communicate enough right now. Things are going to change. Communicate the fact that things are going to change. People need to know that. People need to know, here's where we stand today. And that it might be different from where we stand tomorrow. People need to know what you need from them, and just be prepared to set aside the time, because people are going to go through this process at a different pace. There's no formula. There is no formula. There is no manual. They're going to go through this at a different pace. Their fears are going to come at different times, and they're going to be afraid of different things. That's kind of all I had. John covered a lot of it, right? A lot of the specifics of what that sort of looks like. So, and I was thrilled to hear it. But really, it's communication and understanding that while we are all in the same crisis and all experiencing the same trauma, don't forget that, but we're not in the same boat. My boat is different than your boat.
Perfect. Thank you, Laura. I did get one or two questions in here. Sorry, this one's very long. I'm trying to read through it. But there is a question basically saying that during their staff meetings, they take time to talk about really the world, what's going on. Is that a good idea, or does that put too much focus on the bad?
That's a great question. I think that that's where you have to sort of judge the feedback you're getting. I think it's a really great idea if that's what you are basing some policies off of, right? If that's what some actions that you are taking are based off of, like, hey, so this was in the news. If ask yourself the reason you're sharing it, I guess is my point. So are you sharing it just to have a conversation? Maybe leave it out. Are you sharing it because you want to know how people feel about it or how it impacts work or that it's changed something? Then absolutely bring that up and talk about it. I think, one of the things that we're advising people to do individually is take breaks from news and take breaks from editorial and commentary and all of that. So if it's just more editorial and commentary, maybe skip it and stick with the facts.
Thank you. There's a question here saying that when we feel like one of our employees may be beyond fear and may need some additional help, where can we send them resources?
Well, absolutely. Meridian is been open for business the entire time, and we've gone to a telehealth system. So, one call to and we are still open for if you need to come in physically, but one call to our access center can absolutely help that person maybe figure out what it is they may need, or what, and if it is counseling or is therapeutic intervention, we can absolutely provide that. The other option would be to be sharing some self-care resources with your staff. Having this is a great example, right? So you guys have these webinars. So we're talking about, these topics today. I can't tell you how many organizations I've been asked to come to and do stress management workshops. Like, hey, so normally we talk about, how to invest our money, but today we're going to talk about, how to do deep breathing and how to manage our catastrophic thinking. Provide those kinds of resources to your team as well. Consider that. But if it's really just somebody that you have identified, you treat that the same way that you would if you identified somebody that was having a mental health crisis during any other circumstance. This doesn't change that, you may need some therapeutic intervention if they're not able to manage it on their own. And Meridian's absolutely here for that.
And thanks. I see that David shared Meridian's information in the chat.
Thank you, David.
And so please type in any other questions that you have for any of our speakers. We appreciate you all being with us. And John and Cindy, do you have anything you want to add after both presentations? I think I've unmuted you if you had any additional comments.
Would just want to double down on what Laura said about trauma-informed care and how that applies to both the people that you serve and the people who are doing the serving. As leadership, I think it's very common that people say, here's our mission, here's who we're focused on. But if you're not focused on your team, then the quality of services that you're providing to your mission is absolutely, you can't pay people so little that they're in the same food line as people who are coming through for you. You can't treat people badly and then expect them to treat people well. And I think just the more we can all learn about trauma-informed care, the better. I did forget to mention that we've also implemented hazard pay. Not sure how we're going to pay for all of that yet, and I do see my board chair is on here yet, and we can talk about that later. However, it does seem like if everybody else is staying home, to that point about resenting, gosh, why am I working my butt off for 40 hours a week and this person's just answering the phone every once in a while? How do we make that work? So for everybody who has been on our campus from the time this started, we've been doing an extra $200 per paycheck, which is not life and death amounts of money, but it's enough for people to understand that we value them and we value the sacrifice that they are choosing to make to come fulfill our mission.
Thanks for sharing that, John. Cindy, do you have any follow-up or anything?
I just wanted to say, I number one, I always appreciate what John is doing. He amazes me every time I hear what's going on over there at Grace. And, you know, Laura, thank you so much. I think that you put out a lot that I can apply. And I think, you know, something that really resonated was the idea of letting people know that this is just, you know, you're giving information, that information is changing all the time. And that, you know, trying to be upfront with that. And I'm trying to do that with my folks. I tell them one thing and then I tell them, but you know what, tomorrow I've got another meeting and this may be completely different tomorrow. So thank you for that.
Well, thank you all. And I know that Cindy, Laura, and John have given me permission to share their information. So we'll be sure to send a follow-up email that includes all of their information. So we appreciate each one of you for being with us and sharing your expertise. So thank you all so much. Some last minute announcements. I know that John mentioned this and in his talk talking about, you know, what can my board members be doing there in this time? You know, how can we be utilizing them? And so we've had a few of you ask that questions. So the Community Foundation will be hosting a webinar for your board members about how they can be managing the their boards and their nonprofits that you guys are serving. So that will be coming out on the last week of May. So we're sending those details out soon. So be on the lookout for that webinar for your board members. You guys are all welcome to listen in as well, but really encourage your board members to listen. And then the Community Foundation's Board Academy, we wanted to keep that rolling. Many of you have requested some that training to keep going. So we're going to be hosting a virtual Board Academy on June 25th. So again, information for that Board Academy will be coming out on top of this webinar that we'll be doing. So thank you all. Please tune in next week. 2 weeks. We're doing it every other week. So May 27th, I think that's right. May 27th, we will be talking about the changes to charitable giving. So we have a speaker that's going to be joining us from the estate planning world. That's going to be talking about all the changes that's going to be coming around that have been put into place because of COVID-19 and some of those charitable giving IRS regulations that have been changed. So we'll be talking about that in 2 weeks. So join us then. And hopefully I'll see many of you in the next hour at 4 o'clock, the Community Foundation's Philanthropy Book Club. If you have not read the book and you're still interested in coming, we read No More Duct Tape Fundraising, which is all about the rules and best practices in fundraising. So feel free to join and listen in. If you would like, email me. I'll give you the link if you want to listen into our 4 o'clock book club and hopefully have you join us for our next book club. So thank you all. We'll put this on our COVID-19 response page so that you can watch this again or share it with your coworkers or with your board, whomever. And so thank you all for being with us, and please reach out if you need us at the Community Foundation. So thanks, everyone.